Welcome to the Sacad Guled Show, your front row seat to the journey of leaders, innovators, and change makers, redefining what's possible. Today, I'm honored to host Dr. Malik Kassim, a great friend of mine, a dedicated psychiatrist based in Minneapolis. Dr. Kassim completed his undergraduate studies at St. Cloud State University, Minnesota, and currently works in inpatient psychiatry, where he helps patients navigate some of the most complex challenges in mental health. What's inspiring about Dr. Kasim is not just his medical expertise, it's his passion for psychopharmacology, his inspiration and appreciation for the intellectual challenges that psychiatry brings, and the work life balance he's built along the way. Outside of work, he values spending time with his family and enjoys sports, which I know he does because he talks a lot of crap when it comes to sports, grounding his professional life with personal connection and joy. My guy Malik, welcome to the Sacad Guled Show.
Thank you so much for having me.
How are you today, man?
I'm doing good. I'm good.
How's life been, man? It's been a minute.
It's been a minute. Life is good. Same old, same old. I know we kind of get stuck in routine, but I have no complaints. It's nice to be able to make it out here to see you.
Right, right. No complaints is good as long as we're breathing, right?
Yes.
It's the most important thing. Malik, we can get right into it. What initially drew you to towards medicine? Why become a doctor?
Yeah. I've always been into sports. You follow up with sports. Lots of injuries happen. You lose favorite players to injuries, then you kind of want to know a little bit more about that. How long are they going to be out for? What do they need to be able to do to get back? So that's what kind of started to get my mind a little bit in that direction. And then I just discovered that I really liked all things to do with medicine, really, from then on, and I found it super duper interesting. Initially started with love for anatomy. I like anatomy a lot. And so kind of getting into that when I went to college, just taking those like prerequisite courses. Um, and when you're planning on pursuing medicine, you have to do prerequisite courses. So you'll take anatomy, physiology, you'll take general chemistry, physics, things like that. A lot of the science courses, and that kind of preps you for the journey of medical school. Also, you'll often hear people say they like being able to help people. I don't think there's a doctor that doesn't like to be able to help people. We all do. I think apart from that, things that set us, that things that make us different from each other are kind of our secondary reasonings. Some people really like, some sciences over the others. Some people like surgeons, like being more technical or working with their hands. Some people like babies and might go into OB and things like that. I ended up majoring in psychology in undergrad at St. Cloud State and psychiatry,
Yeah.
med school. So
That was my
so
follow up
I-
question. Why psychiatry?
yeah, yep. So I
'Cause
really,
I,
really,
I heard it's
Mhm.
a lot of work.
Yeah, yep. All any specialty in medicine is a lot of work. I majored in psychology. I actually took an intro class as part of the regular gen eds, and I found it super duper fascinating, and I loved it. And then I ended up majoring in psychology. And then once I got to med school, I enjoyed everything that we did, every rotation. And then I saw that we had psychiatry also, and it was kind of a close enough jump, something that wasn't too far stretched and made sense to me. So
That's awesome. How's the journey been? I know in order for you to go to medical school,
mhm.
it seems like decades, right? How's it
It's
been? Because you got to be somebody with a lot of
yeah.
patience, to be a doctor.
Mhm.
Talk about that and that journey
Delayed gratification is the name of the game.
for
It's
sure.
a long journey. So you go through high school. After high school, usually most people do undergrad, so whether it's 4 or 5 years or whatever, if you finish early. Um, Towards the end of undergrad, you start to apply for medical school. Ideally, you want to be able to start medical school after med school is 4 years. Some people do like a bridge year in between, but usually 4 years after undergraduate, you'll do med school. Residency depends on what specialty you're going into. Psychiatry is a 4 year residency. So after med school, I did residency for 4 years to learn how to become a psychiatrist. If you were to go into OBGYN, for example, their residency is also 4 years. General surgery, theirs is 5 years. Internal medicine is 3 years. So depending on your specialty after med school, that'll dictate some of that timeline. But we all usually get done around ish the same point in time, except for neurosurgery. Their residency is 7 years. So they're in school and training for a lot longer than most of us are.
But that's a journey that you would say it's worth at the end, right?
Yeah, I've come to appreciate every step. Um, it's a long journey. It's kind of like looking back now, it's kind of in comparing it to your regular life. When you're little, you can't wait to be older. And then as you get older, you start to miss certain things from when you were little. As an undergraduate, you can't wait until you're done with undergrad and you start med school. Then you get into med school, and then there's some days where you wish you were back in undergrad. Then you get into residency and you wish there were some days you were back in med school or maybe didn't have as much work or responsibility. After residency, there's some days you wish you were a resident again. But yeah, just been, patient, just been trying to, accept things as they are. It's been a really, really good journey. I consider myself really, really lucky as well. Lots of patience, lots of, grinding. And, it's a lifelong journey is what they say.
Oh, for sure. And I can take part of that because I've known you for quite some time right now. From when you start your journey
Hmm.
till now, and you've always been someone who really, appreciate the grind. I know sometimes we talk on the phone for hours talking about
Hmm.
um, stuff like this teaches you, or it lets you know what you made out of, right?
Yep.
I know it's a challenge, but at the end of the day, when you see what's coming,
Hmm.
then you start to enjoy the fruits of your labor, and you have been for sure. Psychiatry can be really emotionally demanding. What makes you work? What makes the work rewarding for your, especially for you personally?
I think making a difference. I don't think anything can come close to or compare to that. Nothing is ever perfect. We don't live in a perfect world. That being said, again, kind of like your regular life, not everything has to be perfect. Maybe for somebody who's very, very depressed, maybe their depression is 90%. Maybe getting them to depression of 50% is going to be what allows them to start going to work again, to getting up to, take a shower, maybe gets them back to eating, makes them a little bit more of a functional person. That being said, it would be nice if depression was a zero. I don't think there's anybody on earth who has depression at a zero, but getting it from 90% to 50% or 70%, that just might be good enough. And then seeing that person that had those disruptions in their life, or maybe they're not able to take care of themselves. Now they're able to take care of themselves. Now they're able to go and find work. Or if they were anxious before, they're less anxious now, and they're able to go to an interview, and they're able to move out of their parents' house, or they're not homeless anymore, things like that. Those are anytime, we come across situations like that where we have, positive results, that always makes me feel good. And it's always really, really rewarding. And keeping in mind with the caveat that things don't have to be, perfect. Sometimes just good enough is really what it is. Good enough.
Awesome, awesome.
Mhm.
Is since you touched depression, is how do you define depression? Because not a lot of people know even if they're depressed or not. A lot of
Mhm.
people I've seen mistake depression with, stress, for example.
Mhm.
What are early signs of depression, and how do you go about it?
Yeah, that's a very, very good question. Psychiatry, part of the reason also why I went into psychiatry is how it's not very concrete, and it's very malleable, and it's really, really fluid. And there necessarily isn't, not necessarily every answer is for every single person. So for some people, depression looks different than others. For some people, when they're depressed, they eat a lot. Some people, they can't eat. Sometimes people will sleep a lot when they're depressed. Other times, some people can't sleep at all. I guess big picture things to look out for: changes in mood, or mood that's lower than what it usually is for you, right? So some people, their mood is just normally a little bit higher than, others. So changes in mood. Sometimes we have people that deal with impairments in like concentration, so they're not able to, concentrate on things as much as they usually are. Of course, we keep track of things like suicidal ideation or thoughts. Um, also some of the things that we look out for, people may experience like racing thoughts or like negative thoughts about themselves that are really, really frequent throughout the day and that kind of ramp up in that regard. Um, People will maybe are more withdrawn and they don't do like hobbies as much, or maybe they don't talk to family as much as they used to. So it's kind of a loaded question. If you look at our book, the DSM, we do have diagnostic criteria to go by. That being said, it can look differently for people. Yeah. So yeah. So
Awesome, awesome. No, that's very beneficial. What causes depression?
it can be due to a number of things. There are instances where people can be depressed just because. Sometimes we have something called seasonal affective disorder that's really common around this time of year. So, um, less exposure to sunlight, just people not going out as much, that can lead to people being depressed. Some people are genetically predisposed, so there is a correlation between different mental health diagnoses and genetics too. Of course, stressors, right? So, like big stressors, like if you lose your job, for most people, that's going to cause a significant amount of disruption in your
Hmm.
life, and that's going to make things not go so great. Or relationship issues, just increased, responsibility, or maybe more responsibility at work. So that's also a kind of a loaded question. Sometimes just an adjustment or a change can bring on depression for somebody that maybe you've been in the military for the last 20 years and then now you're back and this is the first time in your life that you've just been, amongst regular civilized civilians, and you went into the military when you're 18 and now you're 38 and this is your first time doing things on your own or just being out and about. So lots of different answers.
Thank you for answering that. And one of the reasons why I asked that question is because you know mental health, stress, depression are things that people really overlook,
Hmm.
and that could have a significant change in your life or in your lifestyle.
Hmm.
So for me, it's one of those things that I really spend more time now that I'm older to
Hmm.
spend more time on it,
Yeah.
because as we're busy building, you never think about you know mental health, or how your mental well-being is
Hmm.
so important to you.
Hmm.
So for me, it's that's why I asked.
Hmm.
And trust me, until you explained,
Yeah.
like, sometimes you can never tell.
Hmm.
I eat a lot.
Hmm.
So does that mean I'm depressed? Or
Hmm.
do I just love food and I'm foodie?
Yeah.
So I just like to kind of figure out the science
Hmm.
states out there. So appreciate you for explaining that.
Yeah, no problem.
Going into this segment, Malik, in your experience, what are some of the most common misconceptions about psychiatry and mental health treatment?
That's a very good question, also. I would say, in general, as a society over the last number of years, and even while I was in residency in med school, society has been kind of focused on the stigma towards mental health. And I feel like we're more, mental health focused, charged society in general. So we pay attention to those things a little bit more. So stigma is the first thing that comes to mind, right? Because nobody wants to talk about mental health or admit that they struggle with mental health. And in the past, that's kind of been like a scarlet letter, but nowadays, not as much. In terms of misconceptions, some of the things that come that pop up in my head right away. Because you see a psychiatrist or see maybe your primary care doctor in order to treat a mental health issue, that doesn't mean that you're branded or that this is something that's going to stick around for life. I like to give the example of treatment for depression. So, for example, if somebody comes and you end up diagnosing them with major depressive disorder, usually the standard of treatment, be it medications or therapy, will do medications or therapy. We'll do that for about 6 months. During those 6 months, you'll continue to see your psychiatrist. If you're seeing a therapist, see your therapist, work with your psychiatrist, maybe increase the dose, decrease the dose, change the medication, things like that. Then at the end of about 6 months is just for the most part when we kind of do a little bit of state of the union. Where things are you feeling good? Do you want to stay on the medications? Do you want to not stay on the medications? And then go from there. I have a lot of folks who come in in that situation that I just described, maybe first time ever dealing with depression in their life. And a lot of what is weighing heavily on their minds at that time is, now I have this diagnosis and this is going to stay with me forever. Or once I start this medication, I have to stay on this medication forever, which is not necessarily the case. After about 6 months, let's say this person and the psychiatrist decide, we'll try getting off of the antidepressant, get off the antidepressant. For the most part, if you have a reoccurrence of depression in the future, then we recommend, instead of 6 months, staying on the medications, giving it a year. And then you can repeat the process, maybe work on getting off the medications or stay on the medications. A lot of people do that too. If you come back again with a third episode of depression, then we recommend usually just staying on the medication indefinitely. That being said, it doesn't mean that you
Stop.
yeah. And so, those are a couple of the things that come to mind. Oftentimes, like movies like One Flew Over the Cuckoo's Nest, or in general, Hollywood, right? Cinema, we see psychiatry, and it's not usually the depressed folks that we see. It's the people that are psychotic or that are manic, and their representation more often than not isn't accurate compared to what we see in real life. So that's also something that comes to mind for me. And yeah.
That's well put together answer. I really appreciate you, Malik. I know the stigma is big
Yeah.
out there, especially in our communities.
Yeah.
People will never talk about mental health
Mhm.
and how do people struggle. But it's a very important topic. Like I said, I've been really
Mhm.
big on it. That's why in the NBA, who was it? Kevin Love.
Yep.
Was it DeMar?
DeMar DeRozan has
DeMar
talked
DeRozan.
about it.
Who else?
Mhm.
A lot of people are just
Mhm.
start to struggle with that, and I think the more you talk about it, the more it is beneficial for you to
Mhm.
to be better at it, right?
Absolutely. I always enjoy seeing athletes, or for the most part, I will say athletes. I always enjoy seeing athletes come out and speak about their, challenges with mental health, right? Because I remember as a kid, what do you want to be when you grow up? You look at all of your,
Yeah.
favorite athletes, and, it takes up so much of your life, whether it's video games or trading cards, and then you go to school and you're playing sports and you're talking about sports. It's a really big part of your life. And these people are really, really influential.
For sure.
If LeBron James speaks about depression, it will hold a lot more weight for a lot of people than me speaking about depression.
Right.
That being said, life is really, really hard. It would be extremely, very rare for somebody to make it throughout life and live 80 years, 90 years without ever being depressed, or without going through grief of losing something or
Yeah.
someone, without being anxious.
For sure. And a lot of people might question these athletes, have
Mhm.
money, because what the conception that we have is when people have money, you're at peace, right?
Yeah.
You're at everything looks normal, everything.
Mhm.
But at the end of the day, these people are humans.
Yep.
They got lives. So,
Mhm.
including me,
Mhm.
sometimes you think this person's life is so perfect.
Yep.
What do they have mental health issues for? right? Do
Absolutely.
you want to touch that? How
Mhm.
money doesn't really know peace?
Yeah, kind of how I described the symptoms of depression, and how it could be different for lots of different people as
Yeah.
far as what it looks like. And we get into the rat race of living our lives. For example, I mentioned the delayed gratification, and kind of as I moved through different stages of my career, looking back, like, man, it was kind of nice being a resident, or it was kind of nice being in med school. It was really nice being an undergrad. You see your friends every day, you hang out,
Yeah.
you might not have class every day. We we all are in various stages of life. We also don't exist in isolation. Oftentimes, you'll hear athletes talk about the amount of stress and pressure that comes along with being an athlete and having as much money or resources as they have, and that they're being pulled from every which direction, and the stress of supporting another entire family or friends, and not being able to say no. So there's struggles and challenges. Yes, I mean, it could look different, but it's still, the same thing at the end of the day. And as far as treatment goes, it's going to look the same, whether it's for you or for them. Um, I think that even looking at our lives, there were times in college where you're broke and you don't have much, and you think, man, after I finish this MBA, or after I finish this degree, once I get this job, and once I start making $100,000 a year, then but then you get to those points and a lot of the, the
Things
issues,
come out of the woodwork. So.
yeah, things come out of the woodwork, and life is still hard. This is all apart from like having your own family or having your own kids. And, then you start to think about those things, and those things kind of weigh in on the back of your mind, apart from how you're navigating through life. How is my navigation of life perceived by my kids or my spouse, or my extended family? And, how can I support my kids to not feel, as bad over XYZ? Um, you know, communicate to them that I have experienced this before and things will be fine. That's hard to tell people that, are in a certain stage, or that are like kids, for
For
example.
sure, for sure. No, man. Family can be tough sometimes,
Yeah.
especially if
Hmm.
you're like um, the person who really made it.
Hmm.
Either CEO or doctor or whatever the case may be.
Hmm.
They don't take no for an answer,
Hmm.
and sometimes that could really cause a lot of mental issues.
Hmm.
Getting attacked from every corner because um, you're this person who they think they can solve
Hmm.
all of their problems.
Yeah.
And trust me, we know each other. We're both big on families and how
Hmm.
important family is. But goddamn, how many
Hmm.
people can you satisfy? It's
Yeah. It could be challenging, even if you don't deal with that necessarily. A lot of times, right? Your line of work, you help people, you provide a service, you want to be helpful. It would be really strange and odd if that did not translate to your personal life.
for sure.
Even if people aren't necessarily asking you for things, of course, you want to be able to help to, the greatest extent that you're able to. You want to be able to be a part of, your local masjid when they're doing fundraising, or your kids' school when they're doing fundraising. And there is a little bit of a sense of guilt that can come along with some of that too sometimes, especially for me personally, when I don't do some of those things, or I'm not able to. So that's something that weighs in the back of my mind. That's pretty heavy also.
Yeah, yeah, no, for sure, for sure. How do you deal with your own mental health while helping others? I guess.
Yeah, and I know you alluded to that in a few questions ago. Um, a big part of that for me, having a mentor, or having, whether it's you're in training and having a supervisor, or just like your other co-residents or colleagues. It's always nice being able to talk to somebody who's going through what you're going through, or who's in the same field, or who has gone through it. That is always going to be invaluable. Not to say that, like talking to family who are in a different field isn't, as helpful, but sometimes, what does the trick is talking to somebody who's going through what you're going through. Or if you're in residency and there's a big change, being able to talk with your other co-residents about it. So for me personally, I'd probably rank that number one, as far as how I kind of manage, my mental health, and just, day to day life of being a doctor, whether it's the group chat or phone call, or talking to, people that you work with. Also, a big thing for me, I really, really have come to appreciate my family and my friends that aren't in medicine, or that are in other fields, and being able to talk to somebody about stuff that's not medicine related. And found that to be really, really grounding. And I know, like, a lot of times we'll talk about sports. I feel like it is not that often that whenever you and I have a conversation that we talk about work,
Yeah,
really. Like, we'll talk about sports, or we'll talk about
family,
family, or we'll talk about,
a lot of
other
things.
things. Yeah. Or just, what's going on in society lately, or, hip hop, or, and, you find that for me at least, I feel better, after those conversations, because it's a sense of normal,
Yeah,
being able to detach. So that detachment I've found to be really, really invaluable. Of course, I like my sports. I like my video games whenever I can. I like hanging out with my wife and kids too, and that's always going to be,
beautiful.
something that I do.
No, no, for sure. I can agree more because when I feel like talking, you know, not that I have a lot of people that I talk to
Hmm.
about personal stuff,
Hmm.
because most of the time during the day it's about work.
Yeah.
I'm always in this mode.
Yeah.
So are you. So like when I call or talk to Abdi
Mhm.
and his nonsense, right?
Yeah.
And
Yeah.
and play, go to the gym, play basketball sometimes.
Mhm.
Talk to your brothers
Yeah.
that can really relate to whatever you go through,
Mhm.
whatever you're feeling. I think it's a great sense of enjoyment for me,
Yeah.
at least, and
Mhm.
also part of um, checking on you, right?
Yeah.
Without needing anything.
Exactly.
Because sometimes you see people in your caller ID that you haven't heard from years,
Yeah.
and you already know,
Mhm.
can you do this for me?
Mhm.
And I'm like, is this like the only real time that you're really calling? So
Mhm.
I do really appreciate those small
Mhm.
conversations
Absolutely.
that can take for hours. How important working out,
Mhm.
how important it is for mental health and your own well-being, going to the gym or playing basketball or lifting or whatever.
Very, very important. Other than diet, probably the most important thing to make sure that you're doing. I know it's always really, really difficult carving out, the time, the energy to be able to do that. We're all guilty of not, not doing as much as we can or as much as we should be doing potentially. But if you look at the literature and the evidence, we always do encourage, working out. It doesn't mean that you're working out like, you're Steph Curry or LeBron James or,
Yep, yep.
like old Arnold Schwarzenegger.
Yeah.
Walking is good enough, 15-minute, I know they say brisk walk, but a 15-minute walk and, or a 30-minute walk, when you can, kind of squeeze that into your schedule. I think one of the other things for me that I came to understand also, especially if you're somebody who's done a lot of athletics growing up or maybe competed competitively in athletics, working out as we get older, it does not look the same or mean the same thing as when you were younger. I know nobody's as fast or as strong as they were when they were 22. And so working out doesn't mean you have to do the same things you were doing when you were 22, but it could mean pickleball, right? Everybody does pickleball now, or swimming, which is really low stress, low pressure on, joints, and people tolerate it pretty well, or hiking, kind of substituting those things and for previous activities that you used to do. But yeah, strong correlation between mental health, positive results, and working out, and of course diet, which is another thing that's always really, really hard to.
Yeah, for sure. No, we're going to get into that for sure. But yeah, the gym is very important.
Mhm.
How many days do you think are the bare minimum that you should really dedicate to the gym? Either if it's walking, lifting. Um, I know it doesn't have a number, but to you,
Mhm.
what will be like a bare minimum number of days that you should go to the gym?
Usually when you go to a doctor, they'll recommend like 3 days of physical activity, like
Okay.
up to 60 minutes of physical activity. Um, doesn't mean necessarily that it has to be you have to run for 60 minutes or walk for 60 minutes, but you could split it, half and half or whatever you would like to do. But usually 3 days. Right. People get busy and people have things to do. Sometimes that's not attainable. Again, kind of referencing my personal experience, maybe not being able to do things that I used to do when I was younger, but being able to do different things, you can transition. So maybe once a week is a good start,
Good
right?
start.
Do it once a week for 2 weeks or 3 weeks and see how that goes. And then try twice a week and see how that goes. Or maybe instead of 30 minutes, do 15 minutes. You can kind of do it in a graded fashion and work your way up. There's absolutely nothing wrong with that. It's just something's better than nothing.
Absolutely. Just even if it has to be walking, right?
Yeah.
Let's get to we'll come back for some of the other questions. Let's discuss an important topic,
Hmm.
diet.
Hmm.
Um, what is your recommendation for dieting, and how does it look for you? What is your go-to meals per se a week? When would be the right time? The last time to eat during the day, at night. Talk about those important aspects.
I will say I am the worst person to speak about diet because I have a really bad sweet tooth and I eat a lot of
You're not the
crap
only
that I
one,
shouldn't.
man.
Crap
You're
that I
not the only
shouldn't.
one.
Um, Diet is always going to be a topic of controversy,
Yeah.
right? We have the Atkins diet, we have the Mediterranean diet, we have intermittent fasting, we have this. there's always a new diet. They come in waves, and then people will stick a new name on it, but it's just a formulation of a previous diet that people have done in the past. I personally don't have any recommendations in regards to diet consistency or like schedule per se. Because then the other thing too is a lot of people, our schedules, are different. Sometimes you eat when you can or you eat when you have to. The big thing about diet, and kind of alluding to evidence and what the research shows also, is that people, again, we're all different, we're all independent. You might need 2,000 calories a day. I might need 2,300, in order to maintain my weight. People are different. People are different in gender. Kids' physiology is different than adults. So it depends person to person too. So sometimes people will see somebody that does the, what is it called? Like the keto, right? That,
Yeah.
oh, so and so did keto and she lost 30 pounds in 6 months. And I've been doing keto for the last 6 months and I've only lost 15. People's bodies are different. Your metabolism is different. Maybe they were doing more exercise on top. You never know. So doing what works for you. Some people maybe need more carbs than others. Some people maybe need more fat. Some people maybe more proteins. This is all within the context of any dietary restrictions,
More
that
sweets.
people
Do you
have.
need more sweets?
More sweets, if you need that. So so listening to your body and eating when you're hungry. The one thing that we can all, I think, speak on for the most part is like portion size, right? Especially like in our community and like, my culture, like you eat rice. It's
Big
multiple
portions.
servings of
Yeah.
rice, or like spaghetti. And so trying to, cut those portions down a bit. And
Hit it in the meat.
exactly. Yeah. And everything's just loaded. So usually doing what works for your body or what your body responds most to. If you're dieting in a fashion that makes you really, really depressed, or it makes you irritable and then you're just angry with everybody and everything, that doesn't do you any good and it doesn't do anybody else any good. And it's not going to last very long, right? Because you can only take so much and then eventually you're just going to go back to eating whatever you usually eat. Um, Fasting in general, it's a good practice. I know from a religious standpoint, we do
Yes.
fast, and other cultures and religions, they fast
That was
too.
actually my next question. You
Hmm.
know, the intermittent fasting.
Hmm.
I know a lot of people are big on it.
Hmm.
Um, how is it? Have you ever tried? Have you ever did intermittent
I've
fasting?
not. No.
What do you know about it? And if you do you want to tell our listeners, what the benefits are? I know for
Hmm.
fasting, it gives me a lot of benefits
Hmm.
for sure. But
Hmm.
if you want to talk about how important, or
Hmm.
what benefits it brings, that'd be
Yeah.
amazing.
For me personally, I haven't done any of the intermittent fasting. I've done the fasting that we do during Ramadan, of course. I know the general idea behind fasting is having extended periods in which you're not eating. Usually, they want you to do like 10 or 12 hours that you're not eating. Oftentimes, we can kind of achieve that in at nighttime because we're not eating while we're sleeping. That being said, we're also not using up as much energy as we do while we're awake. So that's why we try to fast while we're awake. Um, Reducing things like insulin resistance and like the amount of cholesterol that we have floating around. Those are some of the goals of achieving intermittent fasting, and regulating some of like your appetite cues as well. Intermittent fasting historically for centuries, it's been, a thing. I mentioned some people say 10 hours, some people say 12, some people say 8 and 16, 8 hours a day, the day you can eat, but you have to fast for the other 16. Some people say 8 hours of fasting, and the jury's out. I'm not
Yeah,
I'm
yeah,
not
yeah.
too sure on what numbers are best for who. And then people will sprinkle in different like dietary restrictions like during the day, and that's also different for people as well. Um, Big picture though, kind of like with, for example, during Ramadan, if you're fasting during the day, but then at nighttime you eat more than the equivalent of what you usually eat in a day, and it's doesn't really make a difference. And if anything, sometimes you can gain a little bit of weight. So while you're eating, being mindful and being dedicated to what you're eating and when.
Yeah, no, very important because I really love fasting sometimes.
Hmm.
Out of nowhere, it makes me feel better.
Hmm.
I think it's very important, and the reason why I asked you, I know you're not a nutritionist or anything like that,
Hmm.
but I know as a doctor, whatever you put in your body is something that you can really that can have anything
Hmm.
on later on in your life. For
Hmm.
somebody who is struggling with heart problems,
Yeah.
kidney problems,
Hmm.
your doctor might tell you sometimes you need to stay off of certain foods,
Yeah.
and that's why we always talk about
Hmm.
what you put in your body right now.
Hmm.
You're gonna regret it later
Yeah.
when you're in your 40s, because
Hmm.
when you're in 20, you don't really care about
You can eat whatever you want. Yeah.
you know
Yeah.
like what are calories, we
Yeah.
don't know, so
Hmm.
I think that's the importance of it.
Hmm.
Let's talk about these so-called silent killers:
Hmm.
high blood pressure, cholesterol, diabetes. Why are these conditions so dangerous, and how can people really detect them early in life?
I'll start off with detection. Following getting a primary care doctor, following up with a primary care doctor. That's also something like for me, I've been extremely bad at over the years. I went to school in the Caribbean, so I moved around a lot. When I came back, I did rotations in different cities, lots of moving around then. You get into residency and then you get kind of busy and it can be hard to, not it can be hard to think about going to the doctor when nothing is wrong with you and everything is fine. But annually we are supposed to, you should see your primary care doctor. And based on, your age, demographics, things like that, then they'll follow up with routine like metabolic labs, for example, like checking in on like blood sugar, cholesterol, also monitoring like, blood pressure. That's going to be your best shot at, finding out something is wrong or creeping up or, I should pay attention to this. Maybe everything looks great, but your mom and your dad both have diabetes and your grandfather had high blood pressure and your dad's blood pressure has been increasing and he's only in his 50s. And so maybe I need to pay attention to my blood pressure. And then that's when it's important, after you have a PCP, being able to follow that PCP. And that's somebody who knows your story and knows your risk factors and then knows you as well. And building that rapport and gaining that trust, kind of going back to what we were just talking about. We see so many different things online on social media, so many people, this friend is doing this diet, this friend is doing that diet. Going back again to how we're all individuals in working with your primary care doctor, you guys can sit and talk about your body, what your body needs. Based on XYZ, your body needs X amount of calories we anticipate. Oh, we'll have you chat with our nutritionist and build out a plan for you. And that's going to get you more in the right direction and give you a better chance at achieving your goals in terms of, weight loss or maintaining your weight. And then, hopping around kind of and trying different diets and things like that. Um, so yeah, we call them silent killers again, right? You can't see it, feel it. For high blood pressure, the day you start to have physical symptoms of it, that means something is very, very wrong and that blood pressure is way too high. But for the most part, we can walk around and blood pressure is high and nobody knows it, can see it. Same thing with diabetes, same thing with high cholesterol. And then when you hear about it, it's when something goes wrong, whether a stroke or, a heart attack, or whether somebody's blood sugar is way too high and now they have numbness in their feet and they're falling all the time, or maybe they had to get a toe cut off. Um, so again, that goes back to why, working with a primary care provider is so important. It's part of what we call ideally primary prevention. So identifying a potential problem or preventing a potential problem before it becomes a problem. So maybe with your family history of high blood pressure, your mom has it, your dad has it, your siblings have it. Maybe making sure that your weight is optimized or that you're doing what you need to do as far as diet goes, so you don't get to the point of having high blood pressure. Or if you come in and you have high blood pressure, what can we do to make sure that it doesn't become higher or doesn't become problematic? Or, is there any way we can control weights to get weight to a point where it drops blood pressure enough so that you don't have to be on medication? Or maybe we can get you from needing insulin to only needing the oral medication, or prevent you from having to need insulin. Um, so yeah, it's kind of I know a loaded question with a
Yeah, yeah,
big answer again, but
yeah. So you're saying with lifestyle change,
mhm,
conditions can change. So if you're on a medicine for blood pressure,
mhm,
changing your lifestyle, changing your diet, weight loss, Because a lot of people think once you're on blood pressure medicine,
Hmm.
it's a permanent thing. So you're saying you can come off of it if you do a lifestyle improvement.
Yeah, again, we're all different, but it's not something that's abnormal or that's super rare that or that we don't hear about. It's about working with your provider and your level of commitment and getting a generalized understanding of your body. um will peel people off of medications. Sometimes they'll have gastric bypass and then that resolves a lot of their issues. Sometimes they lose a bunch of weight on their own and then now instead of being pre-diabetic their blood sugars are just normal. So yeah, it's if anything, it might just be a matter of stopping the progression, right? So maybe you do have diabetes or your blood sugar is a little bit higher than it should be, and we have you taking this oral medication. That in combination with you making changes to diet and working out will help prevent or prolong you from ending up on insulin or having to do the like the injection.
Yeah, yeah, yeah.
So which one would you rather have? I would rather take the oral medication than have to take the shot.
Yeah.
So
And you're more than likely to have it if your parents had it. So always those are good
mhm,
indication to kind of be careful, if you knew that your parents had high blood pressure or
mhm.
diabetes, just to kind of watch out for that.
Yep, and that's why we ask about family history, right?
Yeah, yeah,
Whether
yeah.
it's before you go to the hospital and you're filling out the documentation, or once you get to the appointment and then talking to your family, it's just something to keep on our radar. Like I mentioned, maybe you might have raging diabetes up and down your family, and everyone that has it popped up randomly when they were 30, and then this is the primary care doctor's first time seeing you and you're like 25, 26, and everything looks fine, but it's just something for them to remember. Or they might say, yeah, I usually wouldn't check a blood sugar today, but let's check one just in case, just to see.
Awesome, awesome. No, that's it's very interesting.
Mhm.
Man, if I could stop eating all of that,
Join the club. Yeah, it's hard. It's really
especially the
difficult.
food that we eat in our communities,
Yeah,
the sweets,
yeah, hmm,
the cholesterol,
yeah,
the rice, because a lot of
hmm,
people might think, rice and spaghetti
hmm,
might not be a problem, but
hmm,
it's just
yeah,
it's so tough,
yeah.
so
It's hard.
tough.
And then you get kids, and then you eat what your kids are eating, and then the
The dad
diet
bod,
goes.
right?
Yeah,
Like
everything
it's gotten
goes to
worse for
crap.
me,
Hmm.
when I get kids, it's
Yeah.
there's times that I really remember that I never used to really watch my weight, and now it's like,
Yeah.
damn, every little
Yeah.
thing that I put in my body
Hmm.
is like, how can I really make sure it doesn't really make me bigger?
Exactly.
So it's like
Hmm.
it's a struggle, bro.
Yeah.
But thanks for explaining that.
Yeah.
Um, let's talk about our next part of this segment. You mentioned that life, work balance is important to you. What routines or boundaries help you protect that balance? Like, what are some things that really help you to have a great life work balance?
That's always a hard one, especially in medicine, right? The hospital's never closed. Um, I always have my phone on me because, you never know, things might pop up, or you follow along with like group chats and things like that. Um, I think, well, number one, sometimes you don't have the mental capacity or the physical energy to do something, and being a little bit more choosy. Like back in college, you're just hanging out in your dorm, your friend comes over, oh, let's go do XYZ, let's drive down to the cities. And you're like, whatever, you get up
Yeah,
and then you go. But like now it's not,
yeah, yeah,
it's not that way. Just being mindful of, how deep that well is, kind of dictating more time and energy towards your kids, spouse, and those things that need time and
yeah, yeah.
energy, before anything else. So for me, that's been the hardest thing to be able to kind of work on, and that's always a work in progress, because as you go through residency, maybe you have more call, less call, your schedule's a little different. Maybe you're working nights and then everyone's awake during the day, and being able to try to figure that out. I would like to say, I know for a lot of people it's a matter of being able to turn off your phone, or like turn off your work phone. I don't do that. I can't really do that, especially the days where I'm on call
Yeah, yeah, yeah.
24/7. But
How
for
often are you on
people,
call? Once a week, twice a week?
So I'm on call every other week. I'm on call Saturday and Sunday. It's a 24-hour shift basically. Then I'm on call Saturday and Sunday.
Oh
So
wow! So that means that phone rings, you're on the clock.
yeah,
Oh, okay. Wow. Okay. Okay.
yeah, which is better overall than it was during residency, but still, it's still something that I deal with and I have to bounce. Or then you get into the game of oh, today's Saturday. I have to remember my phone is on. I usually keep my phone on silent, and it's nice to have the watch and the watch will ding, but
Yeah.
remembering, yep, I'm on call today. I need to take my phone off silent, or okay, now I can put my phone on silent.
Awesome. Awesome. No, it's a good it's a good routine for sure.
Mhm.
For students or young professionals considering psychiatry,
Mhm.
what advice would you give them about building a meaningful career?
I would say make sure you are interested in whatever field or specialty you want to go into. Um, that being said, it is not that difficult to be interested in any of the specialties or fields, right? I went to med school. I love OB. I loved general surgery. I loved radiology. I really, really loved psychiatry too. And so I could have seen myself doing like any of those things. At the end of the day, you are a doctor. You become a doctor. It's more so a matter of what would you like to do for the rest of your life or until you retire. And so enjoy your rotations if you're a med student. Enjoy your rotations. Just give everyone a fair shot. If you're a student in undergrad, shadow as much as you can. I know COVID made it really really difficult to be able to shadow, and nowadays hospitals they're coming around a little bit. It's a little bit easier to get into shadow, but even if you can't necessarily shadow, reaching out to a provider in the community and see if you could have a sit down with them or maybe a phone call and chatting with them. Um, I think the meaningfulness aspect of it comes with the territory. It just comes along with the job and just the work. If anything, knowing that the amount of work that you've put in and the amount of money that you've put in,
Yeah.
you know, things are progressing and that you're closer to achieving your goal, that is meaningful within itself.
Yeah, well put. For sure. I know at this day and age, a lot of the youth, the next generation. I know they all love to be entrepreneurs.
Hmm.
To be into business and entrepreneurship. Do you? Because I usually tell them, in order for you to become a great business person, you really have to work at big organizations
Hmm.
and learn transferable skills
Hmm.
and learn meaningful, lessons. Would you advise them to? Doesn't really matter if they want to be doctors or not, because you're somebody that is a great role model for the next generation, right? And I mean it. Would you really advise them to, when they graduate from college, instead of starting their own business or working with family members, would you say go work at Target headquarters
Hmm.
and be in that environment where you're working with people that you don't know?
I've seen a couple of your posts on IG in reference to this too in the past, and
So I'm
I
big on
believe
that.
I liked
Yeah,
them.
yeah.
Yeah, it is. I 100% recommend it, especially here in Minnesota. And we have people that are born in Minneapolis. They never leave Minneapolis. They've been in, my family's here and my friends are here and they never leave Minneapolis or they just go around that little radius. And that's the end all be all. And that can, I'll only do something that I know I can get, or I only want to work with somebody that I know. That can kind of get you a little bit stuck and that limits you, I feel like.
Your options.
Yeah, it limits your options. Whether it's in business or medicine, you're going to have to do things that you've done for the first time or that you are really, really terrified to do, but you have to do it.
Yeah.
And I mean, in undergrad, to kind of speed things up a little bit, I took a couple of the primary core science classes. I went to Bemidji with a friend of mine who lived close to Bemidji, and so I stayed in Bemidji, like that area, for a summer. That's very different from the cities or Rochester or at New
Yeah.
York. And um, I've worked in nursing homes. I've worked in retail. I've done lots of different kind of odd jobs, and you learn a lot, right? Apart from transferable skills, you learn a lot about yourself and you learn what I'm capable of, what I can do, what I can't do, or maybe I need to work a little bit more on. Um, it teaches you a lot about professionalism and navigating, corporate America, or, the, medical system. Things that, when you have the safety net of, certain connections or working with family, that you aren't afforded, or you don't have as much of like that accountability or responsibility.
Accountability, big
Yeah.
word, yeah.
So I always do recommend that. And, I know there's always a debate, parents want kids to stay for college and don't go anywhere far. And whatnot. There is value to going away from college, or going somewhere further out and learning to be on your own, learning how to pay rent, or learning to communicate with a landlord, instead of your parents doing it, learning to set up doctor's appointments once you're 18 instead of your parents doing it, or learning about, taxes and how I'm going to navigate that, or what is work study and how is that going to help me be able to pay for school. Even if your parents are helping you pay for school, sometimes we'll have parents who are, are in a blessed position. They're able to just pay for everything, and the kid never sees a bill, or they never see a tuition email, because it always goes to their parents.
Exactly.
But there's value in going through that yourself, and knowing, hey, this is the deadline, or what options do I have? Oh, I can do a payment plan, or I can do this, or I can do that. Maybe I need to look into scholarships. And then that kind of gets your mind to be a little bit more forward thinking. So it's always really, really nice being able to, work with, family or friends, or have a connection, for a job. But I do think it's invaluable in going to corporate America, or in working for, people you aren't related to or share blood with, and being able to, gain that experience and, see what that's about.
No, for sure. And thanks for touching on that. Like I said, I'm really big on that. For example, I'll give you something that that we posted a couple of months ago, saying that, if you're 18 and over, or even 20, you need to move out of your parents' house.
Mm-hmm.
And, within our culture, that could really be looked at it in a wrong way, especially in Minnesota, the kids these days, right?
Mm-hmm.
But for me, I meant that in a good way,
Mm-hmm.
because when do you really find out that you are responsible as a man?
Mm-hmm.
When you really, in my eyes, that's when you really taste the struggle.
Yeah.
When you taste hardships,
Mm-hmm.
when you're thrown out, thrown in somewhere, and you don't know what life is like
Mm-hmm.
without your mom and dad. So a lot of the kids out there were really pissed and angry, and saying that, you can't be really telling that to the kids
Mm-hmm.
and the youth. And for me, it's an excuse,
Mm-hmm.
because sometimes we, like you said, we struggle with accountability.
Mm-hmm.
If you're a grown man, that you're done with college,
Mm-hmm.
we all know how much we love our mothers
Mm-hmm.
and our fathers. And if you live with your mother and you want to help your mother, you can still help your mom
Mm-hmm.
by living on your own.
Yeah.
It's not an excuse for you to say, "Oh, I'm living with my mom and helping her out,"
Mm-hmm.
and the rest of the time you're just traveling,
Yeah.
and you're buying companionships,
Mm-hmm.
because these are real life scenarios that I see every day.
Yeah.
So, and then that leads into, I'm gonna save until I get married.
Mm-hmm.
How do you know you're responsible? How are you haven't really taken care of yourself
Yeah.
by yourself. How are you going to take care of someone else?
Mm-hmm.
So for me, I'm like, sometimes I'm confused how and this is Gen Z.
Mm-hmm.
They have a lot of good qualities and also a lot of questionable qualities.
Mm-hmm.
So for me, some of the questionable qualities that I'm saying is that, things like this,
Mm-hmm.
in my book, in order for you to be responsible, to find out what you're made out of, you really have to live at your own at some point.
Mm-hmm.
You know,
I left for college when I was 17,
Same.
because I finished a little bit early.
Yeah.
I think there's always a happy medium. There's always, we get caught up in the extremes, right? So previous generations, like the generation before us, it was, as soon as you're 18, you need to get out, or people say, you need to start paying rent if you're going to stay here, which I don't think is necessarily very helpful. also on the opposite end of the spectrum. Oh, just stay here. Don't go away to college. Don't do this. Don't do that. Just stay here. And everything in this world is this nucleus that's around you, and everything else doesn't matter or isn't as important or valuable. I don't think that that's helpful either. I we've spoken about this in the past. I've learned the most about myself and life when I've been on my own and I've been in a tough situation, or I don't have the rent money. I need to figure out how I'm going to talk as a, young,
Yeah,
young person to this landlord, and
yeah,
that experience is
yeah,
is invaluable. Um,
for sure.
and so I think there is a happy medium. We also we also at times will default to doing things that are safe. Staying home is safe. Home is also always going to be safe. But in going out and exploring and doing things on your own and maybe not being as comfortable as you would be at home, knowing, okay, I know how to navigate this situation, or just as importantly, I know when I need to call my mom or I need to call my dad, or maybe I need to figure this out first or try to figure it out first before calling my mom or my dad. Or I will let my mom and dad know about all of this, but I want to try to take care of it or figure it out,
Yeah,
beforehand. And I think that's all, super valuable. It doesn't really matter what you say. I don't think it's ever going to matter what you say. There's always going to be people, of course, that are, unhappy or that lean one way or, lean another. And kind of like with the diets, right? It swings like a pendulum. We'll go one way, and then a few years later, we'll go all the way the other way. And the happy medium in between is always nice. Like, you don't have to go to Europe to go to college or move to the East Coast or West Coast, but maybe a couple hours away from home and being
yeah.
able to see your family still, like that, maybe what's best for you.
Or even going to the,
Mm.
uh, like for example, you have camps,
Yep.
right? And you
Hmm.
still live in Columbia Heights or Blaine, whatever the case may be.
Hmm.
Just find that, just find that, you know, time where you can really say, I've done this without my parents.
Yep.
And I think the younger that you learn that, the more successful you become.
Hmm.
If inshallah, if you
Hmm.
go over and over. So we are reaching the time that we.
It's quick.
But yeah, right, right. My last question: what does Malik wants to be remembered? What legacy do you want to leave as a person, father, doctor, whatever the case may be?
That's another loaded question.
I only ask
Yeah,
loaded questions, by the way.
I was gonna say, yeah, all of your questions. Yeah, you gotta increase the timer next time.
Okay.
Um, that's hard for me to answer. I think I'll start with my kids since that's the first thing that comes to mind. You always want to be somebody that they can count on, somebody that they can take things away from, the good or the bad. I would like for them to be able to adopt my good characteristics and be able to identify the ones that I struggle with and maybe not, you know, um, you know, struggle with that, or maybe in general just have insight, in regards to some of those things. Um, of course, with your spouse, you always want to be, the ideal partner to them, or somebody that is appreciative and their spouse feels like, they appreciate them, their efforts, and in general being married to them and that experience, and is somebody that, they can rely on. Um, with your family in general, I would hope to be somebody that, again, is someone that can be relied on and trusted on, and just in general, a good person, right? We always want to be
Good
or
person.
try to be a good person. That's what is a good person. That's a whole nother, conversation. But I think maybe more importantly, not be a bad person or as bad of a person. If anything, sometimes might just do the trick. From a professional standpoint, right, they call it the practice of medicine because you're always practicing, and you're always learning, continuing education. Just trying to be accountable and stay up to date on things that are changing, whether it's from a medical standpoint or a societal standpoint. The patient population, people in general that we come across today are a lot different than they were 10 years ago versus 20 versus 30 years ago. And being able to kind of like mold and adapt and be able to provide the same standard of treatment. So a good doctor is, you know, what I would what I aim to be. I know I mentioned earlier, sometimes we get in the rut of, you know, wanting or expecting, you know, things to be perfect, and that's not the case for everything. So
We can ignore that.
okay, yeah. We I mean, we all would like an A or an A plus. A C is still a passing grade,
Mhm.
and some days a C might just be good enough. It might just be what you need to get done, you know. Or you know, a B. A B is still a good grade. And so being able to extend yourself that grace and have that understanding and knowing, you know, you can try again next time.
Beautiful, beautiful, bro. No, you are someone that I really um look up to as a friend. I know sometimes
Same
we have
here.
a lot of times where we're never serious about life and we just joke around and talk about sports and whatnot.
Mhm.
But your great qualities really are inspiring. Having 3 kids, me having 3 kids, always talking about family issues, family great times, challenges about life, and somebody who really I find to be a good brother, somebody that I can really, say I learned something about you every time I talk to you. So I'm sure you'll be remembered as someone who's really have an impact in people's lives. So
We'll find out one day.
yeah, right, that day will come. Well, you've heard the man. I hope you learn um, a lot about Malik as much as I did. Until the next episode.
Thank you.
Remember that song? Until the next episode.
Of course.